Before we get started, I would like to go ahead and do the introduction for our COVID-19 literacy ECHO team. And I would like to start with Dr. Bergen, lead specialist in MON.
Hi, welcome everybody. I'm Dr. Ruth Berggren, infectious disease specialist, professor of medicine at UT Health. I direct the Center for Medical Humanities and Ethics. I'm a member of the Health Confianza team, and I'll be moderating today's panel discussion. Thanks for being with us.
Thank you very much. We have Dr. Jason Rosenfeld.
Hi, good afternoon, everyone. I'm an assistant professor in the Department of Medicine and a team member at the Center for Medical Humanities and Ethics, and then finally the implementing director of the Health Confianza project. Good to be with you again today.
Thank you very much. We have Mia Kisako-Vento. Thank you very much.
Hi, everybody. I'm Mia Vento, and I am the Senior Project Coordinator for Health Confianza. So thanks for joining us today.
Thank you. Thank you very much. We have our didactic speaker for today's session, Dr. Luz Garcini.
Hi, Luz Garcini, Assistant Professor at the Center for Research to Advance Community Health at UT Health San Antonio.
Thank you very much. We have a case presenter, Antonio Martinez.
Hello, everyone. Antonio Martinez. I'm with Health Confianza, and I work there as a community outreach coordinator. So I go out into the community and visit people on a regular basis.
Thank you very much. We have a panelist, Joaquin Muerte.
Hey, y'all. Joaquin Muerte. I am a community health worker, community outreach specialist with UT Health Center for Medical Humanities and Ethics. I am also an organizer with the Health Confianza team.
Thank you very much. And panelist, Dr. Ferrer.
Good afternoon. My name is Robert Ferrer. I'm in the Department of Family and Community Medicine at UT Health San Antonio and helping with the public health response on COVID in San Antonio as well.
Thank you. Thank you very much. We have a panelist, Santos Barrientos. I hope he joined already, or maybe he joined us a few minutes.
Yes, I'm Santos Barrientos. I'm a community outreach coordinator with Health Confianza and UT Health San Antonio.
Thank you. Thank you very much for joining us today. These sessions are possible because of you, your interest, participation, and support. Your feedback is very important for us. I'd like to go ahead. I have some announcements and updates. Please remember that pre-ECHO survey you receive when you register. Please complete that. Towards the end of the session, our team will also send a link for an evaluation. For this session series, we're offering the CME, CNE, and Ethics Continuing Medical Education. To obtain those credits, please follow up the instructions in the chat. I'm gonna go ahead and give you the activity code is 100-89908. As a part of our agenda, we are going to have next didactics, incorporating cultural awareness into clinical communication. Following that, we are going to have a discussion in some scenarios. ECHO IT will share instructions for case submission in the chat. Case discussion is an important component of the ECHO model. Case-based learning is one unique aspect for the ECHO model. We invite you to submit the clinical and non-clinical cases. Finally, ECHO is all teach, all learn environment, so we encourage you all to participate in our conversation today. Let's go start with our didactics. Dr. Garcini, this is your space. You may take it away when the presentation is in the screen. Thank you very much. Dr. Garcini, you are muted.
Yes, is it better? Yes.
Perfect, thank you.
Thank you. Thank you for the introduction, and thank you for giving me the opportunity to share with you some of the lessons learned in working with the community, particularly during these challenging times that we have lived over the past 3 years. So some of the things, a lot of the things that I'm going to say in the presentation today, you probably know in having worked with the diverse communities that we have here in San Antonio, but they are still important reminders of those things that we need to keep thinking about when engaging with diverse communities. Sometimes what seems common sense is not always as straightforward. So it is important to understand the constraints that we have during our task, the clinical caseloads that we have, our busy lives, but that we still pay attention to these little things that important things that we'll be talking about. You don't have to do all of the strategies that we provide you today, but just pick a few that will work for you and try to incorporate it into your everyday interactions with the community. Next slide, please. Next slide. These are just some disclosures about my work and memberships. Next, please. And for the objectives about today, we will be talking about communication with patients, with audiences, with communities of diverse backgrounds. And even when you think that this is a community that you're very familiar with, there's always things that we tend to take for granted, or there's biases that we have in our perceptions. So it's important that we listen to these skills and try to apply them when working with the community. Next. So now in terms of what are some of the lessons learned over the past 3 years of this pandemic that has certainly changed the lives of many of us, changed the way in which we process and listen information, change who we trust about sources of health information, who we trust, we don't trust, where do we go to for information. So there have been many lessons learned, and hopefully in the next couple of slides I'll be able to summarize what has those been for me as a provider, as a researcher in working with a lot of the underrepresented communities that we have in San Antonio. Next slide, please. So next, for some reason the graphs are not showing. So next one, and we can have the full slide show up. So one of the things that we know is that the COVID pandemic has led to widening of existing health disparities and inequities across the board. And this is nothing new. These inequities and disparities in our health services, in the delivery of health information has existed even before the pandemic. However, the context of the pandemic, and not only because of this new issue that we didn't know how to deal before, but also the controversial sociopolitical environment that we have faced has even widened a lot of the opportunities to access for marginalized communities. So these gaps have widened, and underserved communities have experienced many compounded barriers, such as, I believe we move ahead. Go back, please. There we go, thank you. So a lot of these underserved communities have experienced many compounded barriers, such as the inability of providers to meet the demand, lack of training to understand the culture and the context of these diverse communities. We don't have enough professionals who speak the language of the diverse communities that we serve. There's a lot of cultural needs and beliefs that we're not familiar and that have played a role in the way in which people access sources of health information. Sadly, we've also seen an increase in discrimination, marginalization, and stigmatizing of certain communities. We have seen an increase in fear and mistrust, particularly concerns about how confidential information is mishandled, and so on. People are afraid of being victims of financial scams, and you name it. However, not everything has been negative, and I think this is the message of today, that there are many lessons learned and that communities are very resilient. So it is time to start paying attention as to what are some of those factors that can make a difference in our interactions so that we can move these information sources forward so that people can make informed decisions. And then we also have the complexity of the populations and the diversity of the communities that we serve. Next slide, please. So it is important that we take action now. And the most important thing is that we already know that there's a high cost and there's too many losses. And if we don't take this action now, then when? So next slide. So one of the first important considerations is to engage in self-reflection about your own competence. And probably, I don't know why the slides are a little bit different, but if you can keep clicking to show all of the text on the slides, that'll be very helpful. I think just keep pressing it. Now go back. Okay, it's a little strange. But it is important to practice cultural humility and cultural competence. So when I talk about cultural humility, this entails for us to self-reflect on our own biases, our own knowledge, our own perspectives, and build our ability to step into the other person's shoes and build empathy and try to understand their experience when we're trying to communicate with them. And then it's about building cultural competence, which is about increasing your knowledge base. What are some of the important values that move a specific community that you work with? What are some of the interpersonal dynamics that play a role, such as gender roles in different cultures, or the hierarchies that take place in a family? For instance, I'm of Latino background, so we know that usually our elders have a strong voice in the family. Moms perform certain tasks, dads make certain decisions, and all of this plays a role in how a family comes and makes informed decisions about how to take care of their health. It is also important to attend to the context. So make sure that you become knowledge about the relevance of socio-political events that are affecting the target community. To give you an example, a lot of undocumented families or families living with mixed immigration legal status, where some of the members are documented and some are not, have lived under a lot of fear over the past several years, given the context that they're in. And it's important to keep all that in the back of your mind, because that's going to play a role in terms of how much people are willing to engage with you. So it is important always to look for those things and review carefully your chart, your notes, what you know about the person or the community that you're going to be engaging with. Next slide. So another thing that is very, very important in terms of ethical considerations is to have a clear goal and to know what is your goal in communicating with the people or with the community. And I'm going to illustrate 2 points. The first one is either you want to engage to empower them, or you want to impose certain views to create a health behavior change. To empower means to give someone the authority or the power to do something, to make a decision. For example, to decide if COVID-19 vaccination is the right thing for them, for their family, for their community, without us imposing our views. And on the other hand, we have the perspective of imposing, of forcing, which means something unwelcome or unfamiliar to be accepted or put into place. We have heard about vaccine mandates and how controversial just the thought or the idea is. But the end goal is to push people to do something, to push people to get vaccinated. And you always have to think about how these 2 approaches take place in how you talk to people, how you engage with communities. And one thing I can tell you from research is that communities and people that have suffered oppression and marginalization are likely to respond better to empowering approaches over imposing attitudes. Next slide. So what we tend to use, I'm a psychologist, so one of my favorite approaches to interpersonal communication, it came from the father of humanistic psychologist, Dr. Carl Rogers. And there were several things that he talked about that in the therapeutic alliance, the most important thing is all those verbal and nonverbal cues that you use to engage with people. Some of the things that he emphasizes is the genuineness of the interaction, which is what I was talking about in terms of cultural humility. It requires a self-awareness of your own biases. It requires you to be honest with yourself and with the people that you're engaging with, to be open, to be sincere. It is about trying to break that hierarchy that exists between client or patient and provider, on the other hand. It is about giving people unconditional positive regard. And what I mean by this is to avoid passing judgment or making assumptions about people. So it's important to be aware of invalidated messages. Even sometimes when we are engaging in conversations, when people say, well, I didn't know about that, our first reaction is like, oh, that can't be possible. You didn't know? No one has talked to you about that? We need to think how in the case of the receiver, sometimes those comments might put people down or might feel invalidated. So it's important that we become aware of what are some of those little things that we say and pay attention to the reaction of the people so that we start learning what our approach needs to be. As I mentioned before, empathy is another important thing to consider in our interactions. And this is about entering another people's world without being influenced by our own biases and beliefs. It is also important to be fully present with your body language, with your mind, with your thoughts, and avoid any distractions. And sometimes it is also important to say that we don't know when we don't know certain information that people might ask us. Next slide, please. So what are some important considerations in terms of non-verbal things that you might want to keep in mind when engaging with diverse communities? So how do we use non-verbal language to put people at ease? The first one I have to say is the power of a smile. Always, there is something special about the power of the smile. And even when we're wearing our mask, for all some of those that are older, even you can tell when someone is smiling through their eyes. So it's important that you engage with that. It's important to nod, to modulate your tone of voice. Pay attention to how you're conveying your words, to how you're pausing and speaking slowly without being condescending. And it's also important to exude confidence, adopt open body postures, try to avoid crossing your hands or your arms, use a calm voice, and eye contact. Eye contact is so important, but this you need to do it with feedback. So pay attention when you're engaging with eye contact with someone. If someone moves their eyes away from you, or you can feel that they're feeling uncomfortable, maybe that approach might not be culturally appropriate. So tailor your nonverbal responses to that of the clients, the patients, or the community that you're trying to address. Next slide, please. So other important nonverbal considerations, which are environmental, is be aware of cultural norms and values. For instance, in Latinos, we have the value of simpatía, which is about always trying to maintain harmonious relationships. So sometimes, you might have people and give them information, and just because they want to be a peer pleasing, they might say, yep, I understood everything that you said. Everything that you said is perfect, when they're really not. So try to find out learn about how those values play a role and what are some of those things that you can do to ensure that you're communicating the information effectively. Also, as I mentioned before, interpersonal dynamics and gender role based on culture are so important. Pay attention. Who makes health decisions in the family? And how are those decisions made? That is very important to keep in mind. It's important for you to maximize privacy, to ask permission if someone else needs to be in the room. I've seen this over and over, particularly when families come to your session and they're in there and all of a sudden you find yourself sharing information or talking about that. Ask, how do people feel? How do people feel about staff being in there or other members of the family being there? So always warn people about those issues. Next slide. And in terms of verbal tips or strategies, some of the things that I would recommend is convey interest. Ask about something about the patient's cultural background. Make a comment on make conversation. How is your day going? Ask about the family. Express a compliment towards the patient at that moment and thank them for being there. Thank them for their effort. Trying to use brief faces in the patient's language. Sometimes even if you might not speak the language, if you know that's the population that you traditionally deal with, try to learn how to say hello, how to say bye-bye, how to say thank you in their language, because that conveys that you care. That conveys that you took the time to learn. Use simple language, speak slowly and clearly, and this requires a lot of practice. Sometimes practice with your own family members. Sometimes we get tangled in our jargons and we try to explain things and people don't understand us. The easiest thing to do, if you have younger members in your family like kids, try to talk to them and see if they understand what you're trying to say and work at it. Validate. Use affirmation statements that help patients or clients feel supported, appreciated, and understood, which can improve the engagements in how they're going to process the information. So some examples of that is by telling people, you are not alone. Several of my clients have similar concerns. Or just a simple phrase like, I hear you, I'm listening. And pause and be okay with moments of silence. Give people room to talk. Next slide, please. I'm going a little faster for the sake of time because I think the case discussions are more important. So I'm going to talk very briefly about two things. What you need to pay attention to in terms of your assessment and then how you can intervene. So what are some of the things that you might want to know about the people in front of you before you engage in any type of teaching or learning? You want to learn the patient's, the family, or the community's goal and expectations. Is this topic something that the community is ready? Most important, are they ready to listen to what you have to hear? And then are they willing to listen and how you're going to say it? And you also want to know what are the barriers that you're seeing in this community or in this family or in this individual. What is their knowledge base? What have they heard? What do they know? What are their belief system? What do they think? Or what are some of their concerns, for example, they have if we're talking about COVID-19 vaccination, about prevention efforts. So try to find a theology. Ask, can you tell me more about that? Can you tell me more about where your thoughts come from? Where do your beliefs come from? Teach me about it. You want to learn about people's past experiences. What have their experiences throughout this pandemic been like? What have their experiences with, for instance, COVID-19 vaccination been like? What are some of the contextual barriers that they face in terms of their immigration legal status, in terms of time constraints, in terms of logistics? And most important, particularly when talking about sources of communication, the patient navigation skills. You want to know how can you help them get the information or access to the sources that they trust. So you also want to know about facilitators. What are values that are important to you? What are important things to them so that you can help them move in the right direction? What resources do they have? How is access for them? And what are the sources that they trust for the delivery of that information? Next slide. So now moving on to how do you actually intervene in once you start talking about, once you get all of this information about what you want to know, what are some of the simple tips that you can do to engage with them positively? The first one, I invite you to adopt a collaborative approach. Yes, you are the expert on your health knowledge, but the patient, the community is the expert on their life experiences. We might think we might know them, but it's important that we give them that room for them to come up with that expertise so that we engage in mutual teaching and learning. Probably try to help them come up with a list of pros and cons. For instance, if we're talking about the vaccine, what do they think are some of the pros and cons? Help teach people how to think, help people make informed decisions. How can they put things in a balance and see what's going to be better for them? Provide culturally sensitive materials that have, usually for underrepresented communities, is visuals that have graphics or pictures that are easy to understand and that they can feel that they can relate to. Most important, for instance, I've worked with a lot of Latino communities. When they look at these pamphlets, they say, there's no one looking like me. There's no brown skin in that pamphlet. We need to pay attention to the materials that we provide to them and make sure that they can be accessible. Because other than that, it reminds them of their marginalized status. It's important that we summarize information. Usually, give them 3 takeaways that they can take out of the discussion. And one helpful thing to do is by mirroring. And how do you use these techniques? I'm going to give you an example. You can say, I want to make sure that I communicated what you wanted to know. Can you tell me or please remind me of some of the things that you feel you got out of our talk? It's important to do it in that way rather than say it, what did you understood? Because for people who maybe didn't digest the information, it's going to be really hard to be able to verbalize it and not feel like they're being put down. So always try to put your approach. I want to make sure that I'm communicating things clearly. Put the burden on you and let them say if they understood it or not. And most important also is to not to overpromise, because a lot of these communities have been let down. Next slide, please. I have one more slide before we move to our conclusions, but on a different perspective, if you given talks to a broader audiences, to a community, in a community center, what are some other important things to do? And I would say the number one is to come present with a person that the community trusts. Co-leader an event with a community leader. It can be a faith-based leader, a pastor, a preacher, our community health workers, our promotoras, a leader for a grassroots community organization. Walk by their side and make them an integral part of that talk as well. Acknowledge, and then I'm going to bring up, this is all over the literature, about 2 approaches that are essential to move communication with communities. And that is to adopt a reparation approach and an instrumentation framework. And I'm going to explain what I mean by that. So in a reparation approach, it refers to acknowledging the losses and the damages that have been made. So when you're talking with these communities, acknowledge that there has been a lot of loss. Acknowledge that fear and mistrust is a valid concern given that everything that these communities have been through. And after you acknowledge the background of that community, move towards an instrumentation. And this pertains to helping people feel value by communicating how they are essential to make change possible, how they are instrumental to create change in our society, how they are vital, and how we cannot continue to exist as a society if we don't embark them and bring them on board. It's all about making a social justice statement. It is also important when you're communicating to larger diverse audience to appeal to the audience values. Make sure that you know who's in the audience. And if, for instance, it's a collectivistic culture where the actions of the people are oriented towards a common goal, make sure that you frame your messages in that regard. For instance, I love to say when I'm speaking to my Latino communities, which are high in collectivism, this is por nuestras familias y por nuestras comunidades, for our families and for our communities. The power of that message can move mountains. Make talks a collaborative process. Ask open-ended questions to the audience and let them get engaged. Again, as I said before, use visuals. If you're going to have a PowerPoint, use art, pictures. You see a lot of that in my slides that convey a powerful message that you respect the culture, that you understand it, and that you can see past language. Sometimes visuals convey much more than words. And when language becomes a barrier, just a visual can help us come together. Take your time to discuss sensitive issues. People need attention. We need to start listening to each other more. Next slide, please. So what are the 3 takes away on the talk today? And the first one is the first impressions that are made matter. And it is important before we say the first word. And that's our nonverbal communication. Number 2 is to be open to learning, yet be creative as to how you go about. Sometimes we look at this box and we think it's a black box. I'm not going in there. Yes, be willing to jump in there, but be creative. And you don't have to do this alone. Ask experts, ask your community leaders, ask the people that walk near you, can you help me do this together? And then many of our underserved and marginalized communities have been deemed essential over the pandemic, yet they have not been treated as such. It is important to remember that as important as essential as they have been to us, we can also have a responsibility to be essential in the way that we need each other. Next slide. Next slide. Okay, next. And I think we're going to move to the case discussions now. Thank you.
Thank you so much, Dr. Garcini, for, as always, an outstanding presentation. I always learn something new, and I always feel inspired. And all of us love the beautiful artwork by Roberto Mamani. So great example of how using captivating images can mean a lot and engage an audience. I'm going to be watching the chat for questions, and I'd like to invite everybody. We've got a robust audience here. I see 45 participants. Please put your questions for Dr. Garcini in the chat, and we will try to get to as many of them as we can. But I have a prepared question that I'd like to start with, if I may. And Dr. Garcini, you have long been an expert in the subject matter of incorporating cultural awareness into all kinds of clinical communications. This talk was related to COVID-19 in particular, which is the subject of this ECHO series. I want to know, in what ways have you evolved your thinking, and what new insights have you gained about cultural awareness and clinical communications in the context of what we've learned in the last 2 years of the pandemic?
Thank you. Thank you very much for that beautiful question. And I think in a nutshell, I would say I realized that even though I think I might know answers, my knowledge is very limited. And there's always something to know, even about my own community. So I think it's important that we focus on our lived experiences and diversity that we comes to, but we also tend to find what are the similarities that unite us. And especially over the course of this pandemic, I have to say, has been uncertainty, has been a lot of questioning, has been a lot of learning. And I think if we come to terms with that, we can connect to people even from diverse backgrounds and be an openness to share our vulnerabilities, to share our strengths, to share our knowledge to come out better.
You know, a follow-up question, I think, I'm just going to toss this out, is that there's been such politicization about the response to COVID-19. And so it's not just culture, faith, personal opinions, but also politics that come to bear in influencing people's decisions about COVID-19 and the measures they will or will not take to mitigate or prevent it. What are some strategies for us to help keep the focus on good decision-making for the individual person's health and depoliticizing that?
Yes, very good question, and one that I get asked often. I think the most important one, going back to values. What is important? If you're talking to an individual, what is important to you and to your family? How do you see yourself in 2 years from now? And then in 5 years, in 10 years, what is the message that you would like to convey to your younger generations, to your children, to your grandchildren? What is your legacy? So I think usually when you're rooted in that, it's very hard for people not to say, I want to be healthy. I want to live a long life. And if people have trouble coming with that, maybe kind of helping people to think about, what about your life? What about your legacy? And then on the other hand, also is what, if you're talking to the community, what do you wish for the community? Where do you see the community going? I think rooted in the values and in the strengths, we have focused too much on deficits and what's wrong and what we're lacking, rather than using the resilience in what we have to move forward.
Thank you so much. There's some interesting information in the chat. Neovento has placed a link to the American Psychological Association Inclusive Language Guidelines. And there may be another link that was put in there the AAMC, American Association of Medical Colleges, and AMA, American Medical Association Guide to Language, Narrative, and Concepts. Those are two really good links. And Dr. Garcini, thank you for letting us know about those and sharing them with us so that we could also share to our audience and our learners. Brian Rosamond actually says both of these resources from the AMA and the APA are really great and can share with other providers in the United States. So excellent. Let's turn now to our case. We have two, and I would like to ask Antonio Martinez to present the first case, and I'd like to ask Carly to please bring up the case report form. And as always, I like to remind our learners that case report forms are the best way for you to get your questions to us. And think about this for the next ECHO that will be 2 weeks from now. You are hereby cordially invited to get one of these case forms off our website or email us and ask for it if you have a question that you'd like to submit to the next ECHO's panel of experts. So with that, Tony Martinez, would you kindly tell us about this case that you worked hard on to submit?
Sure. I believe we utilized the free space at the bottom of the form to kind of give a narrative of what actually occurred. This was not a clinical setting that we were in. It actually took place pretty recently in a training where myself and some of the other team from Health Confianza was aiming to train some community health workers, both primarily in a COVID curriculum. And we got to the point in the training where the question had been presented on what were some barriers and some hindrances that people had encountered. And one of the participants was a young lady. This took place on the west side of San Antonio, so I would imagine most of the participants are also from that same part of town. And she bring up a particular scenario or situation of her grandmother presenting. I wouldn't necessarily say an argument, but the reason that they should not be seeking vaccination or anything along those lines was from the grandmother. And that was ultimately because, according to grandma, the pandemic and the natural course of actions that were occurring here was of the will of God. And so you can kind of see a little bit of the narrative down there in the yellow highlighted area. But it at least, the comment at least sparked a peak of interest for the rest of the team. And so and a conversation did occur, trying to gather some more information on what perhaps grandma was meaning. We listened, but the question was asked, at some point, what religion did the grandmother practice? And when that question had been posed, the particular lady, young lady, responded by saying, well, we're Catholic, but, and then she went on to explain a number of other practices that, kind of influence their perception of who God is. And so part of that was, participating in certain natural healings, certain herbs, things that for myself and other team members did not necessarily identify as part of the Catholic faith. But for her, it gave that appearance because grandma used the term God. So ultimately, in diving in deeper and listening to what this particular person was responding to, I can definitely, I did in that moment understand, why she said it the way she did. And then also at the same time know that that's probably going to be a pretty common scenario for most people that aren't too familiar with the differences between religion and other cultural practices.
Thank you so much, Tony. I know you did a lot of thinking about this case, and we still can all think deeply about it. So I want to draw everyone's attention to the questions that you articulated for the ECHO session. And do you want to grab one of those and see if we can start tackling it? Tell us one of your first most important questions about this scenario.
Sure. So the first question that we actually have listed is, how do we balance these external influences in the context of modern medicine, or what we would consider the right best practices?
So we have a number of experts on our panel today, including Dr. Garcini herself, and I'm going to ask people to weigh in, but I'm going to toss this first to Dr. Robert Ferrer. He is a professor of family and community medicine, and he also has been working on health literacy related to COVID-19 in the community. And I wonder, Dr. Ferrer, if you could tell us a little bit about SEAL and lessons learned, and perhaps you can bring something to bear on this complex question.
Sure, thank you. So let me just explain what SEAL is really quick. It's an acronym, the Community Engagement Alliance Against COVID-19. And as the first months of the pandemic played out, it became clear that many urban minority neighborhoods were bearing the brunt of the morbidity and mortality from the pandemic. Places like New York City, which was an early epicenter, and then within New York City, the minority communities, the Bronx, Queens, and other places with just sort of staggering mortality rates and overrun hospitals. So the feds came out with a grant program to go into many urban communities as quickly as possible to do really what we're talking about here today, which was to develop effective connections, communications, hopefully leveraging already existing connections with those communities to be able to get the message out about protections against COVID, helpful behaviors, and we didn't have vaccines even then, but eventually when the vaccines came out, to promote those. So Dr. Garcini actually gave a great introduction to that. The things that I learned in medical school and have carried with me for a quarter century about empathy, respect, unconditional positive regard. And then a fourth one, which is maybe has to do with all four of those, all three of those, which is seek first to understand and only then to be understood, right? So to immerse yourself in the thinking of the community, the population, or even the patient or the family in the exam room with you before you start to preach to them about what they should be doing. And so we try to embody those principles in our local Bexar County SEAL project. And the way we did that was by as quickly as possible reaching out to communities that we already had relationships with through the Health Science Center on prior research programs, Catholic parishes, community centers, large cadres of what you all are, community health workers, to take advantage of the close relationships and the trust that you already have with those communities. And so we would ask them, we settled on a working model where every Monday at 8:30 we sit together with our stakeholder groups and we ask them what's on their mind, because the pandemic, if nothing else, threw us a lot of twists and turns. And so planning even a month out could miss, the important action that month. And so we would say, what is the kind of messaging that you need? And, what are the languages? What are the channels that you need to do that? Is it written materials? Is it PSAs? Is it Facebook posts? And what would help us help you go into the communities that you know so well and get these messages out? And it worked really well. I think we had a wide reach. It was very responsive. It was very nimble. And we just got renewed to do it a second time because the pandemic isn't through with us yet, even if we'd like to be through with the pandemic. But it was a good application of all the public health principles and interpersonal communication principles that Dr. Garcini has laid out so beautifully. And we were able to do our best to stick to them, as the months of the pandemic rolled on.
So how about grandma here in this story? How would you bring these insights from all of your community interactions to bear on this particular interaction where a young lady is referencing her grandma, who is representative of her culture and of her religion, and saying, this is really, my grandmother's against this. And in a sense, I'm going to overwrite something which may not be valid, but in a way, it seems as if the young lady views her grandmother as the voice of what God would want. And grandma is representing both a faith and a set of cultural beliefs and norms. So how would you unpack those and try to help move the conversation forward to empowerment and decision-making here?
Yeah, so my initial response would be to frame something like, well, sure, God created the coronavirus, but he also created an enormous and very capable system of healthcare to do work through his hands and his knowledge that he bestows upon us. I might even run that kind of argument for fine tuning through the parish priest at San Martin de Porres Parish, which is one of our partners on SEAL, to see if he could add some subtleties or maybe ways that he might talk about that in his own sermons for a little bit of religious finesse that I may not have, not doing what he does every Sunday morning. But that would be my initial approach to that, I think.
Well, thank you, because you validate something that we don't get taught in medical school, right? Which is to acknowledge a person's faith and to try to work within that framework as we're communicating a message that is also grounded in science and evidence. So we get very little training about that in medical school, don't we? Luz Garcini, Dr. Garcini, could you bring some insight to this interaction, and how would you take this, and how would you help us move it forward?
Yes, absolutely. Thank you. Well, thank you, Dr. Ferrer, for opening the line on this. I think the first thing that I would do is to validate the person and to use the mirroring technique to say, I understand, I hear you correctly, that God is very important to you and to your family. And then try to dig in a little bit more. Can you tell me a little bit more about that? Can you tell me what is the view in that world of what you believe is? And usually there's a segue to love, because love moves mountains, and that's one way to get at it. But the other thing is to kind of switch the question and says, in your belief, what would God want for your family? And see where that leads you. But usually is when you start moving towards love and towards protecting each other, and towards preserving health and taking care of each other, you can stop arguing for more of the fatalistic beliefs that we have in the Latino culture that, there's not much I can do. Faith is determined by God and it is what it is, but move it more into the avenue of love and care for each other.
Thank you very much. I want to bring the voice of Joaquin Muerte into this, because I know you were also somewhat engaged with this scenario. Joaquin, what about some of the faith healing traditions that we're hearing about in this scenario? Do we dismiss those? Do we acknowledge them? What would be effective? How can we acknowledge them in a way that still allows us to build trust and move the conversation forward?
So like even when we were going through the pandemic and I was in COVID response working for the city, a lot of community health workers were put into the call to respond to community. And we did a lot of case investigations. We would do a lot of community where we'd go into the community and tell people to wear their mask, or at least help push the message of the mask. And a lot of people had the same question, like, what should I do? I don't go to the doctor, or like, I'm afraid to go to the doctor. And so we would ask them too. So what do you already do? What do you already do to make sure that you are healthy? What do you already do in your family, and what are the things that your grandmother or your grandfather taught you? So in this same kind of scenario, we had that same conversation. We said, okay, well, what is it that your grandma already does? What are some of the things that you do in your family? Do you practice in your family? And one of the things she said was, oh, we like burn sage, right? We like do what they call limpia traditions, where they use herbs and smoke, and they clean your spirit. And then they also drink like special teas, like chamomile or lemongrass, or even orange peel tea, to combat illnesses. And so a lot of the conversation that we would say was that, well, it sounds like your mother is 100% about immunity, 100% about building your immune system up. And so then, the conversation went to talking about a little bit more of those. Talk to your grandmother about those. Dive into those. Ask her those questions about what are some of my other traditions of health and wellness in the family that we've practiced. And then we could probably segue into modern medicine if you had enough information about it.
Thank you. And I just thank you also, Dr. Garcini, for your comments about Joaquin's feedback and regarding asking what are your existing resources to help you cope and move towards healthy living. So there were things that were being done, and affirming those is helpful. Now, we could talk a lot more about this really fascinating case, but we have another one. And so I'm going to ask Carly, please bring up the next case report form. And I'm going to exert my privilege as moderator and present this case, which came to us from Dr. Garcini herself. And I would like to summarize it for us. This is a case about an immigrant family, a Latino immigrant family, and the parents, who are in their mid-50s, did get vaccinated, but they have two 20-something male sons who did not, and they all live together, and they disagree about vaccine, and this is causing tension and disruption in the family dynamics. There's a sister who is having a baby. So she's pregnant. We've got a pregnant woman who is vaccinated. I'm saying thankfully so, as an infectious disease doctor. But this new baby is coming, and will live with everybody in the house, including the 20-something-year-old men who are unvaccinated. Now, another contextual feature is the whole family had COVID already. They all did okay. They were asymptomatic. And that experience is now reinforcing the son's attitude about not getting vaccinated. And additional reasons that are given by the sons include, importantly, they are strong men. God is protecting them. COVID vaccines are just experimental. And fourthly, the government will have information on the parents who are undocumented if people go and get vaccinated. And the last two, about government and undocumented status, as well as COVID vaccines being experimental, are things that they have gotten out of social media. So if you'll scroll down, Carly, for us to the questions that are articulated, what should the goal of the intervention be for this family, given the conflict in the family dynamics and the differences in opinions? So tough question, and I know Dr. Garcini will tell us what she thinks, but first I'm going to go to Dr. Ferrer. How would you approach this? Family medicine doctor.
Well, I would want to first listen a bit and hear what they've talked about and what those conversations were like, what came up, and where it went. So a little bit of investigative work before coming in with any response, because it would be very difficult to know what stance to assume before knowing what transpired in the house.
Seek first to understand. I like that. Dr. Garcini, how did you approach it?
Yeah, absolutely. I totally agree with Dr. Ferrer. I think the first issue and the most important was the conflict in the family dynamics that was happening. So how do you even start helping this family to talk to each other, to listen to each other, so that you can find out, then do the intervention? But the first thing was to identify how can parents, with their own views, and in the Latino culture, usually the dad says, this is my house, this is what rules. Mom was in between the dad and the sons, and the family was pulling apart, and it was creating a lot of stress. It was creating a lot of divisiveness, which, is a microcosm of what we're seeing in our society today, is try to facilitate dialogue. How can you start talking about that and listening to each other without imposing your views? And I think that is the initial step of the intervention.
And so then there were a couple of myths there I want to point out. The myth of government interference or exposing undocumented status and that creating downstream problems. The myth of vaccinations being experimental. How would you address a myth? I don't know if myth busting is the first thing you would do. I mean, but maybe after you gather your information, that would be one of the steps, is that you would want to be acknowledging the different perspective, but how would you move respectfully and bridge from the myth to the facts that you would like the family to know?
Yes. So I'm going to talk about the immigration legal status. That's my bread and butter. And I think it's important because for these families, it's real. And sadly, it has been real in many cases. We have breaches in confidentiality that have resulted in detention and deportation. So I think it is important. And it's important to acknowledge that that might be a risk. And it is true. It is possible that that might be a risk. And then, however, to counterbalance that, I usually say, well, do you know someone who is undocumented, who have had the access, who have had in this case, engage in vaccination, who has been vaccinated, what has been the consequences for them. So the use of testimonials, the use of someone like themselves engaging in that behavior in a protective way is huge. So I will kind of help them look for evidence in their own community, people close to them that has done it without consequences. And that was what kind of pushed one of the sons, the other one still not vaccinated, but one of the sons to get vaccinated, that the uncle, who's also undocumented, and their entire family vaccinated, and so far no consequences.
Two quick observations from the vaccination world. We saw people getting scared of being vaccinated at our vaccine hub at UT Health at the School of Nursing when we had a presence of armed guards present, and people actually said that they left the line and they went away, not just because the line was long in the early days of vaccination, but because they saw people in uniform, and that was a deterrent. So this is a real deterrent for some people. Second quick observation, we were vaccinating in a field with Health Confianza, and we were this was a field where there were injection drug users who were part of a needle exchange program, and we'd been asked to come and provide vaccine. And there suddenly appeared a woman and her teenage daughter who were clearly not of the same targeted demographic. They were clearly not the injection drug users in the needle exchange program, and they wanted to be vaccinated by us. And it did emerge, and they felt safe telling us, maybe because of who we were there vaccinating. They felt safe telling us, hey, we just came across the border and we got this other vaccine in Mexico. We need to get vaccinated. Can we get vaccinated here? And I thought that was a pretty interesting twist on establishment of trust. Pretty unpredictable. All right. What was the other question we should focus on in the last minute of this conversation, Dr. Garcini? I don't have the questions in front of me right now, and I know you submitted the case. What else do you want us to learn from what you presented here?
So I think in a nutshell, my message will be pick your battles. So in this case, what is your battle, right? Is it to get the family vaccinated? Probably not. It's going to be very difficult to get those attitudes changed. But I think your best battle in this case for me was to help that family learn how to deal with the conflict so that the communication could be established. And then if you're not going to engage in vaccination, you can at least win the battle of engaging in preventive measures. Maybe start using the mask, maybe reducing your exposure outside the home. But the other one is find out what are the trusted sources of health information. Who do they trust in the community? What are the resources? Particularly the sons have access to technology. Here are some of the facts. Put the information in their hands. Make sure that if they have any questions, you are available so that they have a resource that they can come back to.
Thank you. And could I just add, as the infectious disease doctor here, my focus would probably be to protect that unborn baby. And I would give a lot of positive affirmation to the pregnant mom who went ahead and got vaccinated in spite of some of the myths swirling about vaccines and pregnancy. I'd encourage her that baby will have protection when baby is born because of mom's decision. But then I would encourage the family to think about what can we do to make sure that this precious new life is safe in our household, maybe invoke some of the cultural values around family in this Latino immigrant family. And I think that it might be helpful to get everybody to rally around the health and safety and well-being of that unborn baby. This was a beautiful, beautiful series of cases and presentations. I'm so grateful to Tony and Joaquin for bringing the case to us that you learned in the training session at the Y. So grateful to Dr. Ferrer for jumping in at a rather last minute request to share with us about your experience with the SEAL program, your perspective as a family medicine doctor, and not least Dr. Luz Garcini, who is so articulate and always has something new to teach us about how to communicate effectively within the context of culture. Thank you so much. I want to invite you all to come back. Let's have a robust turnout for our last session 2 weeks from today. Dr. Phil Ponce from Infectious Diseases will be presenting Basically, it's going to be a wrap-up and an update on multiple dimensions of how COVID-19 and addressing COVID-19 has evolved since we started this series. To make it really robustly effective, we need you, the participants, to send us your cases and your questions. If you just have a few questions that you want, email them to us in the format of questions. If you have a case scenario that you think represents a clinical problem from what we're learning, let's say it's about COVID rebound after Paxlovid. We were hearing a lot of stuff about that. That's very confusing. These are the types of things that Dr. Ponce will come prepared to address. So thank you all again. And I turn the microphone over to our hub, our ECHO hub, Dr. Raquel Romero.
Thank you so much, Dr. Bergen, for being our data specialist and the moderator. Thank you for the panelists and the case presenter, Dr. Garcini. Thank you so much for your presentation. And thank you all for being with us today. Just please remember that you can earn your credits, the CME, CNE, and including ethics, continuing medical education. Just please follow up the steps in the chat. The link for the survey is going to be open 1 week. And just please put in your calendar in 2 weeks from now. It's going to be our last session. And we're looking forward to see you. And please submit your cases, your questions. We're here. Thank you so much. And until then, please take care. And thank you again for your time. Have a wonderful day.